So as we have studied the cutaneous innervation of the thigh on the basis of the nerves, now we will go dermatomal wise. So this is the dorsum of the foot. Here on the medial aspect near to the medial malleolus and all, you have the supply of saphenous nerve L3 and L2, L4. Then on the larger portion you have the superficial peroneal nerve, which is L4, L5 and S1. Then on the smaller aspect, that is the cleft between the first and the second toe, you have the deep peroneal nerve supply. The root value is L4, L5, S1 and S2. Then on the nail beds of the toes, you have two different nerves. From on the lateral aspect, lateral one half, you have the lateral plantar nerve, and on the medial three half, you have the medial plantar nerve. On the lateral aspect of the dorsum of the foot, you have sural nerve as well, S1, S2. So now you are going to study about the sole of the foot. The peculiarity of the sole of the foot is, again you have some common nerves when compared to the dorsum of the foot. For example, you have the sural nerve, you have the saphenous nerve, you have the medial plantar nerve and the lateral plantar nerve in the sole of the foot as well. In the sole of the foot, you have just one additional nerve when compared to the nerves that are common in the dorsum of the foot. That is the calcaneal branch of the tibial nerve. So obviously it will be on the side of the calcanea. So calcaneal branch of the tibial nerve is present on the sole of the foot. It is supplied by root value is S1 and S2. Then on the lateral side, just as we saw in the dorsum of the foot, you have the sural nerve. Root value is S1 and S2. Then you have the lateral plantar nerve. Root value is S1, S2. You have the medial plantar nerve, which supplies the sole of the foot and as well as medial three half of the toes. Then you have the branches of the saphenous nerve. Now coming to the whole of the lower limb, the anterior and the posterior aspect, now we will say it dermatomal wise. You have L1 and just below the inguinal ligament. Just below that you have L2. Then you have L3, which comes till the like on the medial aspect of the knee. Then you have L4, which comes all the way down to the dorsum of the foot and supplies the great toe. Then you have L5, which supplies the middle three toes, and then you have S1 that supplies the lateral most toe, the little toe. Then you have S2, which supplies the heel. So if we closely look this, you can see that these nerves can be seen, these dermatomes can be seen in the same way in the posterior aspect as well. See, L1 it is going like this, and then it comes and supplies here just below the gluteal region. And then you have L2, here it supplies the just below L1, like on the middle part of the thigh. Here you can see L2 coming here, supplying here. Then you can see L3, which supplies on the medial aspect of the knee. You can see it over here. And then you can see L4, which supplies a larger portion of the calf and goes to the great toe. You can see L4 here and at the great toe as well. You can see L5, which supplies the three middle toes. You can see L5 here as well. It just has a small portion over here. And then you can see S1, which supplies the small toe. You can see it over here. This you can trace it back up to here. And then you saw S2 on the heel of the foot. You can see S2 here, and it goes all the way up and supplies the gluteal region. Now S1, you saw it in the small foot or the little toe. It goes all the way up and supplies the region above the gluteal region. You can see L5, L4, L3, L2 and L1. So this is all about the cutaneous branch, dermatomal supply of the cutaneous innervation of the dorsum of the foot, the sole of the foot, the anterior and the posterior aspect of the lower limb, as well as the nerve-wise supply of the cutaneous innervation in the anterior as well as the posterior aspect.